Good morning. My name is Steve Hopcraft. I'm the Communications Director for the California Applicants Attorneys Association. Thank you for your interest in our important story this morning. Today we are in front of Kaiser Foundation Hospital in San Diego, where a former operating room nurse, Debbye Mazzucca, will be telling her story about how she was injured at this facility at work and as a result has suffered due to the denial of urgently needed medical care. In fact, the insurance company for Kaiser has defied a judge's order to provide urgent medical care, resulting in great serious harm to Ms. Mazzucca. We'd like to have you hear her story. It is one of thousands similar to delay and deny care due to utilization review. It's taking place across the state. This is the fourth in a series focusing on Sedgwick claims management services. Some of those cases have resulted in the actual death of the patient. Today's was not nearly that bad, but still quite harmful to Debbye Mazzucca. Debbye, we thank you for sharing your story. Would you tell us just briefly what has happened?
Okay, good morning. My name is Debbye Mazzucca. I live in La Mesa, and I'm an operating room nurse with 35 years of experience. I worked for Kaiser for 12 years. I was working as an operating room nurse in 1998 when I fell over at a block of concrete and where I was injured right here at this facility. I love my profession and my job here at Kaiser and the satisfaction of helping the injured, ill, and disabled. Now I am injured, ill, and disabled. But Kaiser and their insurance company, Sedgwick, are not providing the medical care that I now need. I tripped and fell over a concrete parking place barrier in the parking lot. I flew up in the air and landed on my back and knee. I felt stupid. With my coffee and paperwork spread all over the asphalt, I got up, collected myself, and went back to work. By the time I got back to the operating room on the third floor, my left knee had swollen to 3 times the size of my right knee. I kept working the rest of that day because patients needed my help. That's what nurses do. They soldier on through fatigue, pain, and even our own injuries because we are so dedicated to helping patients heal. I reported my injury on the day I was injured, went through Kaiser procedures, and didn't even think I needed to have an attorney. I thought it would be simple enough to heal my injuries and get back to work. Little did I know that Kaiser would turn its back on my own medical needs. I have found that after 15 years of delays from Kaiser and their insurance to get needed treatment, I am now in worse shape than I was on the day I was injured. Kaiser and Sedgwick have destroyed my life, leaving me in constant pain. While Kaiser treated my knee, they ignored multiple doctor's reports that I had also injured my neck and back. In spite of 4 doctors' reports confirming that fact, Kaiser denied that those injuries were from the fall. Once my doctor cleared me for modified duty and having no income, Kaiser refused to reassign me. Instead, they fired me. Later, I found work within my physical limitations with a plastic surgeon. I was teaching a surgical procedure with a team at Kaiser in 2000, when an old and faulty surgical table broke while I was using it, injuring my arm. Kaiser accepted these injuries as work-related, but has failed to provide the care for those injuries. For years, all they were approved were pain-killing drugs. These drug side effects have caused medical problems on their own, like dry mouth syndrome, which sounds innocuous, but it is insidious and dangerous, and I have learned the drugs prevent your saliva glands from working properly, causing your teeth and gums to deteriorate and decay. Mine became infected, abscessed, and threatened my health and my life. My condition worsened. In 2010, my teeth started cracking and breaking off at the roots. I lost 7 of my teeth this way. Sedgwick denied the dental treatment I needed, so my attorney took them to court. In February of this year, the judge ordered Sedgwick to provide this urgent medical treatment. To this day, they have refused to do so. It has been more than a year and a half since the medical expert the insurance agreed upon said I urgently needed dental care. The pain and infection became so unbearable in July that my doctor sent me to the emergency room and 25 of my teeth were removed. I spent the entire month of July in the hospital on multiple painkillers and in agony, and on multiple doses of high-dose antibiotics. Kaiser and their insurance company are defying a judge's order to provide urgently needed medical care. Yesterday, I had temporary dentures put in, still not knowing whether Kaiser will pay for them. But I couldn't go on without teeth, looking like a Cabbage Patch Kid. Kaiser has stopped providing any temporary disability support or permanent disability compensation. They wrote me that they had spent $27,000 over 11 years, and they felt that was sufficient. As an RN, I made that much money in 3 months. Kaiser and Sedgwick have made my life a living hell. I went from being a proud professional to a life of poverty and pain. How can this be acceptable? An acceptable way to treat Californians hurt at work in the state of California and in the country, the US of A. Thank you.
Thank you, Debbie. Now I'd like to hear from Alicia Hawthorne, who is Debbie's attorney, to talk about how Sedgwick and Kaiser are defying court order to provide urgently needed medical care. Alicia?
Thank you, Steve. My name is Alicia Hawthorne with DeLellis & Associates, and I've been representing Debbie almost the whole time of her injury. Originally, when the issue of her teeth arose approximately a year and a half ago, we had the cooperation of Kaiser to go to an agreed medical evaluator. Back at that time, that doctor had said that that care needed to be done on an urgent basis. Despite the fact that the insurance company and my office had agreed to this doctor, they ignored the report and said, we're going to take the doctor's deposition. At that time, the case was again delayed another 6 months till the doctor's deposition was taken in December. During that deposition that I attended, the doctor did not waver at all at the urgency of the need of the medical treatment for Ms. Mazzucca. However, right after deposition, again, they refused to provide the necessary treatment. I had to go down to court for what we call an expedited hearing, where the issues are supposed to be heard on an expeditious basis. However, despite the judge's orders on that day, Sedgwick again did not give the necessary treatment. We had the judge's orders, we sent it over to the dentist's office. However, the way the system works is even after you have an agreed doctor determining that treatment and a judge's orders, they still put it through what we call utilization review. Through that process, their utilization review department again did not authorize the treatment. Instead, they again wanted further and further clarification. In the interim time, the only thing that was happening to Ms. Mazzucca was losing more teeth and becoming more infected. We then had to go down to court again and get further clarification. The doctor has written on her behalf the urgency of this being needed. We have gone back and forth with Sedgwick. And to this day, I cannot say with certainty that all treatment has been authorized despite 2 trips down to court and defying the judge's orders. One of the things that should be noted is that the way the system works is, despite the fact that the insurance companies choose their own medical provider network, they choose which doctors they want. Then they take the determinations from these doctors and still stick them through the utilization review department. And after that, there are still further delays, because if the injured worker gets a denial from the utilization review from, again, doctors picked by the insurance company, we only have the process of going through the independent medical review. We still have no idea how this is going to play out. These laws were just put into effect, and instead of getting an expeditious treatment for any clients, we are waiting months, sometimes years, for proper treatment. Thank you very much for your time.
And today, the California Applicants Attorneys Association is calling for sanctions against Sedgwick for their pattern of conduct of refusing to provide ordered care, in this case, legitimate recommended care in thousands of cases across the state. This is the 4th case that we have publicized showing this pattern of conduct by Sedgwick. In one of those cases, the patient died. This is unacceptable, and the state of California needs to investigate what's going on, not only with Sedgwick, but with all of these workers' compensation insurance carriers across the state that are using utilization review to delay and deny urgency needed medical care. Thank you very much.